what you see in the mirror and who you are, your identity, is a major part of how you interact with the world around you. Our patients with vitiligo often feel distressed, stigmatized, and embarrassed. They have a number of mental health symptoms and even conditions, and they may experience low self-esteem, social isolation, and depression. It's been associated with leprosy and infection, and even can impact a person's eligibility for marriage, employment, and other aspects of life. It's easy to say that this is in the past, but vitiligo continues to occupy a major burden for our patients. In the case of Opzelura, we actually have clinical trial data to show not only the stoppage of inflammation, but the encouragement of repigmentation when it comes to thinking about the skin of our vitiligo patients. In terms of thinking about this as an effective therapy, it's also a safe one too, as it's very well tolerated and side effects tend to be minimal both in the clinical trials and in the real world. We're going to be reviewing 3 unique patient stories of vitiligo here today. Casey, a 33-year-old who had been experiencing vitiligo since his teenage years and had been seeking for a better solution for care. Thanks so much for joining me today, Casey, to talk all about your journey with vitiligo and treatment with Opzelura. Maybe you can kind of take us back to when all of this started. When did you start noticing changes in your skin?
Yeah, I first started noticing changes in my late teens. I had a couple of spots that appeared on my body, and I didn't really think anything of it until I also started noticing the spots on my face. And that's the first time that I went to a dermatologist to try to understand what was happening and to see if there was anything that could be done about it.
And it's interesting that it was really the face is the one place that kind of motivated you to think about treatment, at least. What is it about specifically the lighter colored spots on your face that maybe made you feel like now's the time?
Yeah, the biggest reason why I was concerned about my face was, for one, it's the thing that most people see.
Sure.
And in my late teens, I was fairly self-conscious, you know, as any teenager would be about their appearances. And I was also just concerned about my skin in general and the health of it, especially with like sun and it burning more easily than the other spots on my skin. And as I was tanning, like in the summer, I would notice larger differences between the spots on my face and then the actual parts of my face that would tan.
I think that's a really important part of the story because there's so many different reasons why our patients with vitiligo seek out treatment, and oftentimes it's really involvement of these very cosmetically sensitive areas like the face that are the precipitants in many of these cases, just because, as you mentioned, there's a lot of burden to think about when you start having changes in your face, which is sort of your window to the world in terms of thinking about how you look. And you know, when you saw your first doctor, tell me a little bit about some of the things you talked about, what you may have tried, how you understood this diagnosis.
Yeah, I'll say like at that age I didn't really understand what was being said to me. I went to the dermatologist on my own. I didn't go with my parents at the time, and the only things that just stood out to me that were scary were the words autoimmune, and not really understanding what that meant, and then also just not being told that there is no cure, and the industry at the time not knowing really what even it was other than just a term around it. Yeah. So the first thing that I started trying was steroid creams for my face, and I tried those for a few months, and I never noticed any improvement. It was, and in fact, I would say it created more problems than anything, just because I started getting sores on my face or painful acne. And at that point I was starting to think, well, I'd rather have the spots than the sores or the acne that was coming with the steroid cream. So I stopped taking it, and I stopped treatment for years.
That's such an important part of the story in terms of specifically, we probably don't do a great job of explaining the why behind diseases and why we think about treatment.
Like I said, I had stopped taking seeking any kind of treatment for probably a decade. Mm-hmm. At least medical treatment. I had tried some like alternative medicine things, natural supplements, sure, even diets, just to see if, like, you know, reading online of, oh, I'll give this a try for a little bit and see if it works. And those things never did work for me. But what inspired me to get or seek treatment again was the fact that I started noticing more depigmentation in certain parts of my body, and then also the depigmentation was spreading on my face. And so that's really what inspired me to at least start looking to see if there were other options available now after so many years and to seek treatment.
So take me back to that visit where we first had the chance to talk about Opzelura as a potential treatment choice for you.
Yeah, one of the big things that I felt would be helpful with taking Opzelura was the fact that it was a cream and something that I could take routinely. A lot of the options that I had seen available was light therapy, and I felt like I couldn't fit that into my work schedule very well. There's no way that I could have traveled to a clinic, several times a week in order to receive light therapy for, an hour or more. So the cream option sounded promising to me. And surprisingly, I started noticing some dramatic results in my face fairly quickly. I'm still applying the creams to the spots on my body, and I haven't noticed as much improvement there yet, but seeing the results on my face has been enough of an encouragement to continue the routine of taking and using it twice a day at least on my body and everything. I'm less self-conscious about it, especially in my appearance on my face. In the summer, some people would comment on just, oh, you have a sunburn, you should use sunscreen. And it's like, well, I have been using sunscreen, but it's just that part of my body doesn't tan. So it always appears red, whenever I was out in the sun in the summer. So I'm looking forward to not having to have those conversations as frequently, or to not have as many questions asked about it. But I would say overall it's definitely helped in my confidence, and being able to see some at least noticeable improvements after living with this for probably 15 years now has been great.
It's important to showcase the journey of seeking treatment and the impact it has had, both positive and negative. Some may say that vitiligo is simply a cosmetic condition and not worthy of consideration as a chronic medical disease. I push back on that. Vitiligo is indeed a chronic autoimmune disease that has immense impact on the lives of our patients, mental, physical, and psychosocial.